Just a reminder to silence your cell phones before we get ready to start here in a minute or two. Well, good afternoon, everybody. We'll call this Bridging the Gap Opioid Subcommittee meeting to order. First item of business would be to entertain a motion to approve the minutes from our previous meeting.
So move.
Support. Been moved and seconded. Any comments, questions, corrections, additions? Seeing none, all in favor signify by saying yes.
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 All opposed, say no. Minutes are approved. Well, thanks for coming on this beautiful day. It's my hope that we be 99% done today. And to expedite things, I've gone through the remaining proposals because, as you recall, we eliminated a number of them categorically last month. We didn't get any feedback that we'd screwed that up somehow, so we will leave those in the, I guess, rejected pile. And I've gone through this just using what I think I know about your guys' opinions. I'm going to start with the easy ones where I don't think there's much controversy, and then we're going to go through them one at a time and say yes or no to them. So feel free to stop and interrupt. We'll have as much dialogue. I'm not trying to rush through because we certainly can have, meet next March and this March and April if necessary. But at some point, it's got to come down to yes and no. The good news is, depending on whether or not you guys agree with my rough pass at this, we should have enough money to fund a substantial number of proposals. So we don't have to eliminate maybe as many as we would think. My thought was we'd get it down to 4 or 5, but depending on how you guys recommend, I think it's substantially more than that. So I'm going to start in no particular order, except again, how I think it's likely to be least controversial to least debatable to most debatable. My read on the proposal from Catholic Charities for $72,000 is that was a proposal that folks felt was a pretty good proposal. Is there any disagreement that be one that we would leave intact or that we would recommend? Seeing no objections, we're going to go ahead and put that in a yes column. Now, this isn't permanent yes. We're going to take one more pass when we're all done, but the next one, we had 2 PR proposals. It seems pretty clear to me that the one from Impact Marketing and Communications was outstanding. No, not throwing any shade on the other proposal because they do a great job too, which was from WLEN. Am I incorrect in thinking that that's a proposal we should move forward? Hearing no objection, we will move that one forward. Next one. We didn't spend a lot of time on it. It's not a big dollar amount. It certainly seems reasonable. I left it in the questionable column for me, but the proposal from Inmar for the drug take-back kiosk for $44,000. Is that something you guys agree is one of our ones that we should move forward? Commissioner Collins.
Yeah, I haven't an issue funding this, but we have several take-back locations in the county. I don't know. How many law enforcement do we have, Sheriff? Do you know? Everybody?
Yeah, pretty much everybody has a take back in their facility. And we do 2 drug take backs a year. We're doing a big one coming up here in April. And so I'm kind of like, same with you. And there's already at Meyer, there's already a drug take back there all the time, a facility.
Okay.
I'd also agree with that.
had a lot of involvement in drug take-back days in the past, and they seem to do pretty well. And I think maybe put this in the maybe column and wait to see where we're at a later point.
Okay, Monica?
So I do agree that we do have that, but then my thought is going to the outlying cities and towns and villages and things like that. So based on their presentation, I think we can pick and choose. We can do as many as we want or as little as we want. So I think I would be for it on the outliners.
Does that make sense to you? Because it is interesting to note that all the places you guys thought of were primarily in Adrian. Sheriff?
Clinton Village.
Okay,
Virtually every law enforcement agency has one throughout the county.
okay. All right, so then we'll just do it this way. All in favor of advancing this proposal, say aye. Aye, okay. No shame in that. All in favor of setting it aside, say aye.
Aye.
Okay, very good. This is where it's great to hide behind the actions of the committee. I feel strongly both ways. We had a proposal from Rhino. I got the sense that that was not well received. Is there any disagreement that that's one that we would not move forward? Okay, very good. And then number 5 was the Lenawee Broadcasting, and I think we indirectly preferred the other proposal, which will strike that one. The next one, and we may end up having a longer discussion about some telehealth things and these kinds of things, but Bicycle Health has a proposal for $810,000. My suspicion is that's half of our budget, and we have some cheaper alternatives. Am I wrong in thinking that's one that we would not move forward?
That would be my position.
Okay, good. I suspected that would be the case. The next one is opioid solutions, $196,000 to reduce overprescribing. As you recall, I think that was, correct me if I'm wrong, Francine, but that involved building relationships with doctors and so forth. And I can't say it's meritless, but it struck me as one that seems least likely to produce $200,000 worth of value. We in agreement on that? Good. Okay. Next one, Goldie Health, $540,000 to basically use data integration with EMS, ERs, et cetera, and then they were going to subcontract MAT with Bicycle Health. That was $540,000. I didn't get a lot of warm feelings about that when they presented. You guys' thoughts? Anything contradictory? Okay, that one's easy. Let me see. All right, these next two I'm going to put together because I think they're joined, and I expect this one to have more discussion. And the sheriff and I have talked about this. We're all concerned about MAT in the jail. We recognize that's a need and a value. We have sort of two proposals that directly affect that. One from the Family Medical Center for $200,000, and then the sheriff's proposal, which is substantially more. The 2.1 million over that number of years, of course, exceeds our budget. I want to hear your thoughts. The sheriff's office would have to, and I guess, Sheriff, should you recuse on this part of the discussion, I guess, with respect to your particular proposal?
Yeah, I can recuse on that, other than saying that when it was initially proposed, obviously my captain put in the moon and the stars, and we've had a discussion, and the 150,000 a year doesn't have to exactly go out for, so it could be for a 3-year period. As we tried to establish, because if you remember from the presentation, we don't know what that cost is going to be until we start doing it. So it's kind of it'll be a kind of a litmus test on what it really will entail and what partners that we can work with.
Understood. I don't want to put my thumb on the scale, but I do believe that the commission is probably inclined to not move with that particular proposal either, in favor of the one from Family Medical. Understanding that, of course, these will all have to be integrated with the sheriff, respecting everybody's role in this, but when we really have two proposals looking in that direction, I think, do you guys have an issue? Francine, was that over 3 years? The family medical proposal is probably on your other sheet, but I'm not using that one.
It's a one payment, 200,000 for 1 year.
For 1 year, okay. Other thoughts on that? Am I wrong in wanting to prefer the family medical or to recommend that moving forward? The sheriff?
If I can also clarify, so the amount for the jail is for people who are in the jail. Family medical is once they're released from the jail. So just wanted to clarify that.
Okay. Understood. So we're all clear. How would you interface then with that? So you have somebody that's on the verge of release, would then coordinate with family medical for MAT and hopefully follow-up therapy?
Correct. So medically assisted treatment along with the counseling, et cetera, that goes with it could be provided by family medical once they're released and coordinated through as we talk about peer support, a peer support person would take them to family medical, register them with family medical, and then they would start their MAT with family medical. So this is a continuum of care, but it is for us, they would not be coming into the jail to do medically assisted treatment. We have our provider in the jail, and that's who would be doing the medically assisted treatment, working with other providers outside, knowing that they can't provide everything. So with family medical, and correct me if I'm wrong, Francine, that their role is once someone is released from the jail, that they would do the continuum of care.
It's both. And I was just reviewing this so I can read. They will provide MAT and mental health services to residents and released inmates who are uninsured or underinsured that are able to obtain insurance or secure resources from continuing treatment. Part of their proposals they also talked about is they stated that how many people they would like to serve. However, if those people would benefit from insurance, they could serve more in that along with counseling. So their measurables are to connect with 90% of the released inmates and to have a program of everybody who's being released and to provide mental health and substance use disorder treatment through that. I believe when they did their presentation, that question was asked and they said, I don't remember the exact wording, but they'd be willing to talk with you depending upon how they could work that out to work inside the jail in along conjunction with that.
Okay.
Anything else?
No. Terry? And then we'll go to Sarah.
So if I can read from that, they're willing to look at medically assisted program in the jail.
I believe that was asked when they gave their presentation. It was asked, I believe, to the doctor, the chief medical officer who was here, not Travis. And I think it was someone from the commission who had asked. I think there was discussion between the sheriff and someone there, if I recall. In their proposal, it's written from release.
I remember it from release, not while they're in the jail. And the only reason for that is because working with Vital Core, we would want to make sure that was coordinated, and we don't know if a particular inmate needed a particular medically assisted treatment drug and they didn't provide it, then we would be, if they didn't prescribe that particular one, then we would be kind of at loss for that particular drug. That's why we wanted to make sure that it was our medical that was working with different providers that could do that. That's the
So,
only thing.
so I'm clear on this. Vital Core offers health services to inmates now, right? That's the
Correct.
vendor that does that.
Correct.
But they do not administer MAT? Could
No, they do, they could, yes, they
They
do MAT. They're doing it in other jails as well.
Is the hurdle the cost of the medication?
There's a couple hurdles, the cost of the medication and making sure that there's a provider. So depending on what it is that they needed for their particular addiction. So that's where it becomes kind of one of those things where you want to be able to partner with whoever it is, whether it's Vivitrol, whether it's Suboxone, whether it's whatever, but we want to make sure that our medical people are, because they gotta, the inmates that are in jail are usually staying in jail until a certain time. So we want to make sure that whatever it is that is prescribed to them while they're in jail is something that our medical in jail can also live with. We don't want them saying, no, we're not going to do anything, because then it doesn't help to get them prescribed that in jail. So it has to be a partnership.
So when you say your provider, that's somebody other than Vital Core?
No, that is Vital Core. Our
Okay.
provider is Vital Core.
Okay, so given access to the medication, they can take care of the MAT part while incarcerated now, presuming the money's available for the medication. We don't need to contract with another medical doctor of some kind to come in and administer it while in jail. Is that correct?
I'm gonna, so you've had a lot of contact with medically assisted treatment as well. That's my understanding. But there's always that particular drug that we have to go outside for to be brought in and administered.
Okay, if I can do a brief summation on this, so I can point out a couple administrative things. We will collect these together, but then we will come up with a final recommendation from this body. But then there's going to be an administrative review, probably with me and Francine, and perhaps Commissioner Collins, and Administrator Murphy, as we look at the specific contract ideas. And we will probably have to go back to these vendors and get a lot of clarity on some of these things. So I guess my thought is that if FMC is that entity that we're going to recommend, I don't think there's anything that binds us from having further discussions with them about how we can adjust things to make sure the needs you're concerned about are dealt with in the jail, because MAT without follow-up counseling is an inadequate solution. It definitely needs to be a multi-part scenario. So that's how I see this working. Unless there's any other, Sarah, oh, I'm sorry.
Okay.
Yeah.
Was the sheriff's office not going to be in some type of compliance issue if you did not have more support? Am I incorrect in that?
Say that again?
Some type of compliance issue, like a new law had passed, and if you don't have certain things in place, there could be problems for the office. Am I remembering that correctly?
So there's been case law already, and there's been lawsuits that pretty much say if you do not offer medically assisted treatment in the jail, then you're going to be found deliberately indifferent. And there are a lot of case law on that. So in other words, if you're a jail and you're not providing this, either if someone came in and they needed to continue on their medically assisted treatment, or if somebody came to us and said that they want to be given medically assisted treatment in the jail. If we don't provide that one way or the other, then we would be found deliberately indifferent and basically held liable for a lawsuit for that.
Okay,
I don't know if that's what you're thinking or not.
yes,
Okay.
yes.
So there's no statute or no new
Okay.
set of regulations right now, but I think we all agree that it's good policy and it's something we need to pursue. We're really discussing the mechanism to try and make that.
Okay.
available.
Also in my notes for Family Medical Center, I put that their goal is to have to increase or help 50 additional patients. So that's just 50 patients from the jail. I guess I was assuming that could be anybody that had SUD or the like,
I think I think Francine, please, I think you just read that's,
right?
it's not just
It's
inmates, it's
all,
other people. A number of groups were just listed there.
I mean, because they already do a good job in the community, obviously, but I
That's right.
guess maybe I'm misunderstanding.
You didn't, it was both. They wanted to
Okay.
increase, it was 50 to 55. However, they wanted to really target the uninsured population. And one of their sustainability goals was to achieve 90% of the people that were in need who were released from jail or incarceration.
Okay, thank you.
Right. Anything further before we, oh yeah, sorry, Commissioner Collins.
It's kind of nebulous we're talking about, so let me try to, at least for myself, bring us down to the base level. Question at issue as it relates to the inmates. Can they receive the treatment? Can they get the drug needed? And my understanding is that an outside entity, Family Medical Center, can prescribe. So they can prescribe that treatment. So the question becomes drug availability. That would be the issue regardless. I mean, if they prescribe it, then the onus is to get the drug there for use. So I don't see the issue with an outside entity making a prescription.
Well, nobody inside the jail employed by the county can prescribe now,
I understand.
you know, and the sheriff obviously understands that too. So, no, I agree. I think, based with what we have here, understanding that there's obviously some time for some further discussion, I think we should, move forward, with the, family medical proposal. The next one, I don't think is controversial, but it's a little more complex. The Lenawee County Juvenile Court Mental Health Authority, I think it was called the STOP program. That's $182,000. And was that for, what was the length of term?
18 months.
18 months. It seemed to enjoy support. It'd be clear, however, which I wasn't perfectly clear, that is a program that is taking place now. So it's not a brand new program. But I'd like to hear your guys' thoughts on that program. Is that one that we should continue, understanding that that involves community mental health? So I would, of course, expect Mr. Kelly, who's on the board of community mental health, to stand aside for this process, which is hard because Tim obviously has a tremendous depth of knowledge in all these areas. But on the other hand, we just recommend from here and the board makes the final decision. So,
Commissioner Martis?
yes.
So the STOP program itself is new. It's the collaboration between these two entities of some of the similar things they're doing. It's rebranded to the STOP program, which in essence is new, but the collaboration is not for some of the services. Like, is that correct?
So this is not a new relationship between the courts and CMH, but it's a repackaged and a different, maybe somewhat approach to that. I don't know. It's within our budget. I want to, if you guys have a strong reason to exclude it, I know that we had said last month that we're concerned about youth. We're concerned about young people, and so forth. So, thoughts on this one? For me, it's an in. What do you guys think? Have any issues with that? Okay.
I would be for it.
Okay. Thank you, Gary. Let me see. The last one, because frankly, all the other ones that are left, if I add up the numbers, we don't have to exclude. There's money left for all the ones left, but of course we will discuss them. The question is the value of peer recovery. And we have, let me see, 3 proposals from Parkside focused, is it exclusively or primarily on young people?
The first two, I believe.
The first two, that's correct.
That's
The Youth Prevention and Intervention Program that was directly affecting youth, that was very targeted for a program.
Right.
The Reset for Success was the collaboration with the schools, naming two to do a pilot program. And the last one, Engagement for All, specifically that's for adults uninsured for substance use disorder treatment.
That's right. I remember that's the $36,000 proposal. So we have, and so is the McCullough proposal for peer recovery, is that juvenile directed as well?
It is not.
Okay, so those two don't necessarily compete with each other with respect to the, in fact, they don't compete at all. And tell me, let me see,
Kevin?
they're going to expand that program. Go ahead.
I think there, just to point out, I think there's one more, one that includes it. Family Medical Center isn't part of their proposal, including those that are uninsured and increasing the number that receive Medicaid. Remember, Francine?
With FMC?
Yeah.
Yes.
FMC specifically wanted to target uninsured.
Yeah.
That's correct.
Okay.
And Parkside for this was specifically uninsured. The Engagement for All.
Okay, so if the budget is adequate for both the McCullough Vargas proposal and the Parkside, I guess, how do you guys see, how do we, it's hard because there's overlap in different areas. What are your thoughts on those two programs? One's $165,000. Then we got Parkside for an additional 36, trying to cover some of those similar things. But the two other Parkside proposals are for youth. The McCullough Vargas one is not for youth. So thoughts on those? Any opinions? It gets harder because you need to have some more detailed knowledge about what these guys do. And
Just to point some out, I don't think the Parkside one is towards youth. Remember, the actual
for the peer, for the,
peer recover, or, yeah, peer
Engagement.
recovery will be for adults. Right?
The Engagement for All.
Yeah.
the $36,000, you're right, that's
Yep,
right, that's for
yep, that
adults
would
who
be
don't
for
have
adults.
access to insurance or Medicaid or whatever the mechanisms are for that. Okay, so then is it our preference that we try to accommodate the McCullough Vargas one inside our budget, or do you have a reason to say nay to that, Sarah?
I preferred the Parkside proposals.
Okay, that's where I tend to lean, but again, I don't have deep knowledge.
They were all great. I mean,
Right,
very impressive people. But again, and maybe it's just me, I feel like, bolstering our youth would be a really good thing for Lenawee County.
Terry?
I've had some dealings with Parkside, not personally, but I have had some dealings professionally with Parkside. I personally believe they're an outstanding organization, absolutely outstanding. And just to give you a very quick dose on their, the quality of their staff. We all know that my son has a substance abuse disorder starting from young age. There was one counselor that to my knowledge ever that got to it, that actually got to him and put him on the right road for a short time. That fellow was from Parkside. So I've had that relationship with them, I guess, and seen other involvements. They are an absolutely outstanding organization, in my opinion.
Well, then, if you're going to base it on where I saw this falling down in my list initially, I would include all the Parkside proposals and set the McCullough Vargas one aside, unless there's a strong objection to that. Sarah?
I would agree to that as well.
Okay. Any other thoughts? And here's another one that, then the last one that I think that we need to so two left that really, we can include both. That's the good thing. The budget appears to be there, but one, again, impacts the sheriff. So first, I'd like to hear your thoughts. U-Turn Health is offering telehealth in the jail. I know you're concerned about whatever programs there is one that works well with your stuff. I we don't have any other telehealth proposals, do we, that are focused on the inmate population? Is this the only one?
I believe so, and so I had this conversation with my captain and over telehealth, and he's not exactly in favor of telehealth in the jail. It's just the nature of the beast. I believe that, that having someone in person is preferable to telehealth.
Okay, other thoughts? Francine, did you have any thoughts on that?
Sorry, if you can have discussions so I can read, because this, it's not only for, it's justice impacted. So instead of just incarcerated people, it's justice impacted, but it also includes their families. So you remember, this is with the telehealth for peer supports and the family support.
And Work at Health, was that not also a telehealth
Yes.
proposal? So I know we did say last month that telehealth in some form is a value to the committee. I will say that based on my rough calculations, the money's there for both, if we so choose to do that. But now it gets down to kind of the details of what covers what. And I guess what percentage of the U-turn health was actually for the inmate population? I mean, if it's 20% there and 80 for other justice impacted, okay. And Sheriff, does the captain have I mean, is there another provider or do you just think in general telehealth is not a need there at all?
In general, he's not exactly in favor of, and I agree with him on it. Just from the perspective of the logistics and everything involved with the inmate population, it's just, it may work some places. I haven't had enough interaction with other entities, other jails in Michigan that are doing it, but
Okay, fair enough. And what's the average length of stay for somebody who's there primarily because of substance use? I mean, it's not 60, 90, 120 days, is it?
no, it's not. The average length of stay is probably 45 days. It's not a large amount.
Okay. Tim, and then Francine.
I was just looking at the two different cost amount, one's for 2 years, one's for 3. I guess we're gonna have to make a choice if we're all saying this is something we like, which it's unique and is something not tried before. But if there's not a place for it in the jail at this time, where is U-turn Health located? Where are they providing services from? I guess that would be another defining factor for me. Remember, was that South Carolina?
That was not them. I think that was, Goldie Health was from one of the Carolinas. When they gave their presentation, they talked about they would have somebody in the state that would be a representative to handle the region, to handle that.
Okay.
I don't know what state they were coming from exactly. The description, just to reiterate, their core services is a threefold. One is pre-release, which covers recovery, education, and coaching, delivering secure jail tablets, which includes trauma-informed modules. Introduction to peer coaching. Participants will receive a printed reentry workbook to begin working on their recovery focused and creating a referral process. The second step is the post-release peer coaching, which includes the unlimited virtual sessions. Average length of engagement is 12 to 16 weeks. Focuses on, and they have a lot of different trauma things and emotional regulation. And the third was the family support, individual coaching and education for Lenawee-based family members, regardless of release location of the justice-involved individual, focusing on reducing stigma and healthy boundaries. And it talks about, and they go into, they will help with the peer recovery coach, and all the services will also help to try to find housing, transportation, and those other things. So it is not just a jail-based program. That was just their first introduction.
To be clear, the Work at Health was a 2-year proposal for $300,000, so $150,000 a year. And the U-Turn Health proposal was $284,000 for 3 years. So something closer to 90-some thousand dollars per year, 95 and change, I guess. Thoughts? Terry?
But unfortunately, unless somebody can correct me, we have no experience in this room with telehealth. Nobody knows from whence it comes and how it goes. If in fact it is or could be a successful program, how are we gonna know? If it is within the budget, I think that one of these programs ought to be accepted and ought to be funded so that for future funding and for other, for medical across the world, or, excuse me, the country, some kind of basis. So how does it work? Does it work or does it not? And I do like the idea that the treatment continues post-release. That they don't just say, well, you know, you're in jail for 50 days, see ya, we're all done. They're gonna stay with this individual and with family, so I like, it sounds maybe, I don't know, maybe a little bit obtuse on my part, but I personally would like to give it a shot.
Well, and so Francine, both of these are for justice involved and beyond. Is that correct from your U-Turn and Work It? Just so we make sure we're or was it only Work It or U-Turn is the one that's justice involved?
I'm reading. They were very different.
Yeah, I believe Work It was more of a, if you didn't have insurance or you had private insurance, that they would be servicing more of that population.
So the proposal was for Work at Health is a 2-year project. 1, train Lenawee Behavioral Health Clinical Team on the new model and interventions through geo-targeted marketing and care coordination, increase enrollment and care for Lenawee residents from 80 to 150, and subsidize care and medication costs for 10 of these patients who are underinsured or uninsured. Assess the impact of combined OUD and continuum of care model of treatment for at least 30 Lenawee patients who are enrolled in both programs, and disseminate findings on program results for patients. So this isn't for the justice impacted population specifically written as such.
So if we actually went forward with both, they would not be overlapping in the people they serve.
Correct.
But if we wanted to do a prototype run, we might lean towards the cheaper one to see how that works. So we get some measurables, and at least if they're justice involved, we probably got more data points than general population, but I'm just talking out loud, thinking out loud.
I think U-Turn is the lesser expensive, but
It is, and
that's
that's
what I was kind of enthused about because it continues beyond release.
right. Any other thoughts? Do we want one, the other? I mean, part of me is like, we can do both. But if we get into year 1 or 18 months and it decided this isn't exactly going like we had hoped, we've invested a lot of capital in that for something that's pretty, well, do you want to pick with just then, if we had to pick one of the two, how many of you would say U-Turn? Is that the one you guys would prefer? Okay. Anybody feel that way about Work It in the other direction? That's okay. Not everybody at home can see the face Sarah is making right now. Okay. Well, then let's settle on the U-Turn one based on the number of folks that express that interest. And I'll go over my list. I think, yeah, so that what this basically is saying is that, and Carissa has all the detailed notes, but if I'm looking at this correctly, Yes to Catholic Charities. Yes to impact marketing. Yes to family medical. Yes to the STOP program. Yes to all 3 Parkside proposals. Yes to U-Turn Health. And then we're still a maybe on the drug kiosks.
Just to family medical.
Oh, yes, if I didn't say that, yes to family medical. Is that Sarah?
Did we make a decision on the CMH Pathways Engagement Center?
We did last month
Did we?
because we lumped that into the group of entities needing physical space, shelter, that kind of thing, and we chose not to proceed with that
Okay, I
last.
didn't mark.
Yeah, okay.
you.
All right. Anything else? We glossed over anything? Is there something we need to understand better? Tim?
I think for clarity, just how we're gonna approach the Inmar or in
Right, the kiosks?
the kiosk. How do we decide maybe some opting in, I guess, some communities opting in or pharmacies or whatever remotely?
If we are not going to go with both telehealth proposals, I will say the money is there for the kiosks. It was there even with both. Because your guys' conclusions are roughly the same as mine, except we don't want to spend an additional several $100,000 on 2 telehealth proposals.
Can I clarify
Yeah.
that this was kiosk and the mail prescription bags? So if it was, I know there was some interest or conversation about the prescription mail bags that you could just send them out instead of having to go to a location. So they have 2 programs in one.
And that's something we're not currently, right now we have the drug take back days and the kiosks. Right now, we don't have the mail-in option.
Or the Sharps containers that are frequently required?
Administrator Murphy.
Just as just to help out a little bit, I don't know if anyone else is tallying these up, and I know Commissioner Morris, you said we have room, but for perspective, based on my hand calculations here, I don't have a calculator, so hopefully my math is right. With the ones that you have definitely said, let's move forward with, you are at about $1,270,732 out of $1.5 million allocation.
Yeah, that's what my back of the envelope came up with too. So that's, it's not like we don't have the money for the kiosks. If you see no value, so then with residual money, then we have to ask some additional questions because we've exhausted our proposals as a result of the RFP. The county commission is not bound to only this process. And if we identify other needs, though it would not be the way we've done it, we certainly are free to continue to deploy that money. And there's much more coming, of course. So I guess there's a lot of administrative stuff that needs to happen now as we're looking at contracts and thinking our way through the ones we've settled on, actually interact, and maybe some follow-up with some of the vendors for some additional clarity. I think that there'll be a few of us, probably Commissioner Collins, myself, Francine, Administrator Murphy. We will meet before the next month's meeting to talk about some of those procedural things and have certainly some additional discussions probably with the Sheriff's Department and other entities that are county related to figure out exactly how all this works and to make sure there's so many moving parts. I'm sure there's blind spots that we haven't anticipated, and we want to vet those out certainly before we start putting pencil to paper. So is that a process that makes sense to you guys? Anything else we've neglected? I do think we should meet next month to try and do a final summation and package this up if we can and move it on to the full commission. Francine?
Can we just clarify what Inmar, is that
Oh.
no, yes, splitting it, or just for clarification? Thank you.
Sarah?
I think if we have the money, it's not gonna hurt. I don't know how many people, depending on how many people want to bring their drugs to a law enforcement agency. Just a thought.
Sure.
We are very busy. We get a
Bring 'em.
lot, yeah. And drug take back is,
Oh, I bring stuff to drug take
Yeah,
back every time.
we have
Yeah.
quite a few that drop off there and I don't see, I haven't seen where anybody is shied away from coming to the sheriff's office with them.
How long was this proposal for, Francine, the Inmar? I'm sorry, I know it's all here, but
One-time payment, 1 year.
one, okay, that's.
And the county gets to choose where they want the locations to, if they pick kiosk, but the mailers are completely different.
The one thing I did like about that, because I've been taking care of my mom for ages, is that they did have the sharps. Because I would gain piles of sharps and then take it to drug take back, and because I felt like that's the only place I had available to do that.
Do the kiosks accept sharps or do they just,
They do not.
they do not? Okay,
That was one of the items they could mail in.
right. Is it worth $45,000 for a year to try it or not? I feel strongly both ways. What do you guys think? All in favor, say yes.
Yes.
Opposed? Okay, the yeas have. it. Hope I still get Christmas cards from you all.
Well done, sir.
All right. Is there anything else we need to discuss? Francine, is there anything I've missed administratively? We've covered everything. Let me just say, because we got a couple minutes left, I truly appreciate the time you guys have all put into this. This has been a long process and it's complex, and I respect all your opinions and the effort you've put into this. So it's been a lot of work. Hopefully next month we can finally put a ribbon on this. One of the things that we will discuss over the next month as well is what's the report back look like from these vendors? You know, what's the follow through? Who are they going to come back to? You know, those are all things that we can't just decide here because it impacts our staff and administrator and so forth. So all those things are yet to be decided, but if you have other thoughts about things that we've missed, please email, call, and let us know. Commissioner Collins.
I think we ought to develop at least or make some reality of how these people are gonna get funded and when they're gonna get funded. Because most, if not all of the people we funded are gonna have to bring on additional staff. Bringing on additional staff is a cost. And for some of them, quite possibly, they can't do the cost up front and then get reimbursed. So we need to know how they're gonna get funded and when.
Agreed. And everyone has a different set of expectations based on their proposal, so. But in the end, I've learned that when you have the money, they become very accommodating. If there's nothing else, I would go now to public comment. Seeing no public comment, I would entertain a motion to adjourn.
So moved.
Or
Been moved and seconded. All in favor signify by saying aye.